Saxenda is one of the few drugs approved by the FDA specifically for treating obesity. But how effective is it realistically? And what should you know before taking it? Hi, I'm Dr. Brian Young, a naturopathic doctor in Toronto, and I manage weight loss patients who have used and are currently using Saxenda. And from all their experiences, I'm here today to shed some light into what you might expect if you try it yourself. Saxenda, also known as liraglutide, was actually originally a medication for diabetes called Victoza. It works in this way by mimicking the effects of a hormone called glucagon-like peptide 1 or GLP-1. This hormone stimulates the release of insulin and therefore helps diabetics with poor insulin control. For diabetes, liraglutide isn't used often first since there are much more effective and well-researched medications for diabetes on the market already. However, researchers also found that GLP-1 makes us feel full, so an incredibly intelligent marketing team rebranded it as Saxenda, an appetite suppressant for weight loss. They come in reusable pre-filled syringes. You attach a little needle on the tip and select the dose to inject. Then you hold the injection against your skin for 6 seconds before removing and discarding the needle and putting away the syringe. Doses start low and increase slowly, especially if you've just started Saxenda. Side effects. There are quite a lot of potential side effects. In practice, the most common I've seen is feeling nauseous all the time, followed by gastrointestinal disturbances like diarrhea, abdominal pain, cramping, vomiting, heartburn, and so on. Some people also get a headache or feel dizzy. It tends to go away once you've used Saxenda for a while, but I've seen people continue to experience these symptoms or even get worse over time. You'll need a full health screening before you start taking Saxenda since there are also a lot of potentially rarer but more severe side effects, like damage to the liver or pancreas, gallstones, kidney failure, an increase in thyroid cancers, heart irregularities, and depression or suicidal thoughts. Yeah, there's a lot. Is it effective? The way Saxenda works for weight loss is primarily by suppressing your appetite. In terms of preventing overeating, Saxenda can be quite effective. Some of my patients tell me it's working really well to suppress their appetite and stop cravings, but I find that these particular patients seem to be the ones getting the worst or most persistent nausea. So I'm never too sure how much of it is the nausea stopping them from eating or the actual medication. On the same vein, I'll occasionally notice patients complaining about other side effects that stop them from eating too much in general. For example, complaining about migraine headaches that reduce their appetite. Of course, there are many patients that do feel fine, but the number of patients who have these side effects make me wonder if part of how this drug works is by making you feel too crappy to eat. Unfortunately, the appetite controlling effect of Saxenda seems to wear off over time, with some patients reporting no more effects on appetite as quickly as within a month of continual usage. So I would say that Saxenda tends to be most effective when you first use it, and decreases in efficacy as you continue to use it for longer. Should you do it? Saxenda is best used if you have a hard time controlling hunger and tend to overeat and snack too often. I always recommend developing good dietary and lifestyle habits as they tend to produce more permanent results if implemented properly. However, Saxenda can help those with very strict diets or act as a good tool temporarily while trying to implement more permanent solutions. It might also be very helpful to people who are pre-diabetic or diabetic and are not currently on any medications, since Saxenda or liraglutide is also an anti-diabetic medication. In fact, the doses used in both weight loss and diabetes are very similar. That being said, there are a few things to keep in mind before you use Saxenda. Firstly, it requires a prescription, and you'll need to see your doctor about it to see if it's even safe for you to use. Secondly, you'll obviously have to be comfortable at giving yourself an injection every day. And thirdly, Saxenda is quite expensive if paid entirely out of pocket, around $1,000 to $2,000 per month depending on the dose. Overall, I find Saxenda is a good way to make weight loss protocols easier to follow. If you do decide to use it, I recommend following a more strict weight loss diet since the reduced appetite makes it much easier to follow such diets. But it's important to remember that the drug should not replace the development of good dietary and lifestyle habits. I've had patients stop taking the medication only to gain all the weight they lost right back, because they relied on Saxenda too much. It became a crutch, and they were unable to control their feeding habits once they stopped taking it. Let me know in the comments down below if you have any other questions about Saxenda, or if you have any experiences yourself you'd like to share. And if you found this video helpful, please leave me a like. As before, I'm Dr. Brian Young, bringing you weight loss info on this channel. Subscribe and hit the notification bell if you're interested in learning more, and share it with someone you know can use the help.